Welcome to Resilience Redefined. I'm your host, Michael Osterlink. This show is about building better humans, institutions, and systems. On the show, I'll be interviewing many different experts from across many different fields, including human optimization, health and fitness, team building, mind-body medicine. In the institutional space, we're looking at different institutions and how we can create new ones, new models and maps, including in medicine, in education, in intelligence community, in law enforcement, in the military, especially in the special operations community. Thanks for being here and enjoy the show.
My guest today is Joseph Gleed. He's a self-defense expert, trauma therapist, and former undercover operative with more than 2 decades of experience training elite military units, law enforcement, SWAT teams, private security, and civilians around the world. He's played a pivotal role in rescuing trafficked children globally, including leading the largest operation in Mexican history. A 7th degree Dan black belt in Krav Maga and skilled in multiple martial arts. Joseph is also a licensed clinical therapist specializing in trauma recovery. He's a creator of the Victor course, which we're talking about today, among many other things, which is a mind-body program that integrates self-defense training with therapy to help survivors build strength, confidence, and resilience. Good to see you, Joseph.
Good to see you, Michael.
Been looking for this conversation for a while. Before we get into your more recent program, which you've actually been doing for a while, tell us how you got in, first of all, into the martial arts. You've been into it for a very long time. And then the story which led you to become a therapist, especially focusing on trauma and mind-body interventions.
Yeah, I'd love to. It's a long and twisty story. So we'll leave some breadcrumbs along the way. But I'm a Army veteran. Served served some time in the U.S. Army. From there, I got out and still wanted to continue serving and being active, and got heavily into Krav Maga and as well as other martial arts. I have several black belts. I got pretty heavily into Krav Maga and real world training, including close quarter combat training. And from there, became a special operations trainer. So taught special operations units around the world, from Israel to Colombia to here in the U.S., where I specialize in close quarter combat, and very specific style of close quarter combat that is just real world oriented.
Let me ask you a question. Why Krav Maga? How did you first learn about Krav Maga, and why did that entice you so much that you ended up teaching, especially at the Wingate Institute in Israel?
So, it's interesting. I was doing a lot of martial arts, and I was doing, Muay Thai and Gracie Jiu-Jitsu. Had a black belt in karate already. Um, and I love fighting. Like, I love MMA, like love training, competing. But the thing is I'm a realistic human, and, being able to defend yourself in the real world just means so much more than being able to, have a sport fight and do well, right? Go in and win. Being able to go home and help other people know what to do in order to go home to their loved ones at night just meant so much more to me. And so as I started teaching martial arts early on, I discovered that, as much as I love teaching kind of the sport aspect of it, that just wasn't where, wasn't my path, wasn't my lane. My lane really lended towards the real world self-defense aspect. And so early on, I started training Krav Maga to get that real world, and I wanted to know what to do. From there, what was interesting and what kind of started leading to this work here, is I started seeing a lot of women, men as well, first responders, my veterans, brothers and sisters, coming in, who would come in just struggling, right? Had experienced, many women have experienced domestic violence, interpersonal violence, rape, would come in, and there were times, I can tell you, I can remember one student came in maybe 20 years ago. She cried for an hour straight, right? An hour straight. And I thought to myself, this is just wrong. Like, we could do better. Like, we can do better than this. And I was already in school in psychology at the time. But what was interesting with this story, she cried for an hour straight. She still signed up. She came back. Right. And I thought, this is interesting. Like, this is interesting. Here's this this person who's definitely been involved in violence, was on the losing end, is coming to this class that is male dominated, very, hyper masculine martial art, self-defense fighting class, cries for an hour straight, like literally an hour straight, right? And at the end of that is asking when she gets to come back. All right. And I watched this woman week after week after week come back multiple times a week, come back to that gym. And that had been hard as hell. Like I can't even imagine how hard that was to come to that gym every time. That person, if you would have met her 4 months later in a dark alley trying to hurt her, would probably end you.
Different human being.
A different human being. And I mean, even knowing what I knew, I was astonished. I was astonished at the transformation that learning this, taking these actions could have that big of an impact. And it started a journey, right? Of how do I adapt this, not just for, special operations unit. That's awesome. Those are great and very needed. But, we have 8 billion people in this world. How do 8 billion people live feeling safe and comfortable and confident? And how do we help every individual have that in their life? Because having somebody send a self-defense class and cry for an hour because they've been victimized by other human beings, it's just wrong. It's just wrong. And from that moment, there was more we could do. And I set off on a journey to find that.
So walk us through that journey.
Man, so, I started, I was training civilians, military, the police, Utah. I trained every SWAT team here as partner of the year. And during that time, I started developing the Victor course, which we'll talk a little bit more about. And Victor course was developed for victims of trauma, and usually violent trauma initially. As I worked with a lot of people, like I said, domestic violence, rape, human trafficking. So developed as a course to help individuals overcome the effects of trauma and learn how to live a life worth living, right? Outside of fear. And that was kind of the origins of the Victor course. So I started doing that and working mainly with a lot of women, veterans, law enforcement, doing that. Eventually, I got recruited for security operations on anti-human trafficking operations, which was interesting. It wasn't something I was looking for. I got a call out of the blue, and it just so happens as I mentioned, what I teach is very specific to real world close quarter special operations, right? Or, force on force civilian world. Got a call to come train some undercover operators, all right, who were getting ready to go do a mission down Latin America. And so, I get these calls all the time. That's what I do. And so, of course, not a problem. So we set up some training, started working with these guys. And maybe a couple of weeks later is all I got asked to actually participate in the operation. And nobody had the experience I had as far as close quarter combat, as far as security. And so it made sense undercover operation have somebody like me. And, usually in those, we're going places where we're not armed, right? We're not carrying firearms. A lot of the times, most of the time, there are no police waiting outside. It's us. It's me. I'm the one. Right. And so I got recruited to go down to an operation as head of security and led the team on that operation, where in total we rescued 122 children.
Wow.
In that one single operation. And it was really from that time forward when my world changed. Because the reality is, as much as that I knew, to go down and to see children being sold. And I was the one, by the way, who got to search every single person for security reasons, the traffickers, and every child on that operation. I got to see and talk to and got to feel the experience that they were having. And it had such an effect that I just couldn't allow this to happen anymore. From there, I started on a journey of a decade's worth of undercover operations, rescuing children, mostly overseas, Latin America, some work in Asia as well. And that work really led me to a question, right? And that question was, after the rescue, how do we help these kids live a life worth living? And there's a story that goes along with that, if you'd like to hear.
Yeah, no, please, please.
It really changed my world. Changed my world, and is the reason why right now I'm studying, researching, better ways to treat trauma and to give people a chance. My partner and I, a former CIA operator, and I were going down to some Latin American country for another operation many, many years ago. On the way down, we stopped by Mexico City for news story that was being done on a child we'd rescued, a teenager we'd rescued almost exactly a year previous to that, and been relocated to a girl's home in Mexico City. And they were doing a news story on this girl and the success of, these operations. And, I was blessed to be able to open up Mexico to organizations like ours to do these type of operations. And so this was a real pivotal moment for us, right? We put a lot of work into this. She was one of the first rescues we had in Mexico. And so we're going down to really celebrate, right? I mean, this is not what that would have been, a celebration, right? And so we go down and I'm watching this, and one of my expertise, by just the nature of my work, is nonverbal communication. As an undercover operator, head of security, it's my job to be able to know what the hell's going on, and so I'm an expert in nonverbals. And I'm watching this interview take place, both during the interview, before and after, just through interactions and just kind of being a fly on the wall. And what struck me was not the success of our operation like I was hoping. And by the way, this place was beautiful. She had everything she needed. And she had a home, she had clothes, she had education, she had food, she had there was money there to take care of her. She was miserable. This was a year after the rescue. And I remember thinking, man, all these pats on the back for a job well done. But no, the job wasn't done. And what I learned from this girl, who I come to call Rosa, it's not her name, but Rosa, what I learned from Rosa was the rescue was only the beginning. It was the same lesson I'd been learning year after year after year as I worked with, women who had been raped, who were victims of domestic violence, men who came back from war, law enforcement officers who been injured in the line of duty. The rescue, the event was over, but the effects were not. And so the rescue was just the beginning of Rosa's recovery. And yet we thought our job, what we did, was it. And what we came to realize was there was so much more work to done that we were barely scratching the tip of the iceberg. From that moment forward, I was on a mission to understand trauma, to understand how we as human beings get through that. Right. So that's been the journey right there, is how do we help individuals like Rosa, all right, live a life worth living?
Now, that's led you to a formal education. You're a licensed therapist. I understand you're also doing even more graduate work. Can you walk us through like some of your education, what you've learned along the way, what you see in the field, what you're able to apply in your work presently, what you imagine will be down the road?
Yeah, yeah. So I'm currently a doctoral student at the University of Kentucky in the social work department there. I teach at Utah Valley University in the social work department there as well. My education, I have a master's of social work from the University of Utah, my undergrad in psychology from Utah Valley University, and now doctoral University of Kentucky, where my research now is centered around the treatment of trauma using an integrative approach, multimodal approach to treating trauma. Trauma therapy's come a long way. We know a lot more now, right, than we used to. And there are lots of great answers to many of the questions on how to treat certain symptomology within, trauma presentation. So there's lots of good things out there, but there's nothing really that leads the pack. And in fact, they all kind of are in my opinion, lackluster. Very, very lackluster. As an example, um, cognitive processing therapy, currently favored by the VA, as you might know, is a cognitive-based therapy, right, that was developed for the treatment of trauma. Been used now at the VA for some time. Not a bad modality, except it has about a 50% dropout rate. Right, somewhere thereabouts. Some would be a little bit lower than that, maybe 35%, but the research is pretty clear, right? And so what we see here is, they in trying to treat trauma and trying to help people like Rosa, is that there are some things out there, right? There's some protocols out there. There are some ways to do it, but they're not comprehensive, inclusive, and more importantly, I think holistic.
Yeah. So for you, what is that? What's comprehensible or more holistic look like? And what's when you talk about multimodalities, what might some of those be? And what's the larger model or map you kind of put them into?
Man, that was a great question. Big question. How much time do you have,
Yep,
Michael?
3 hours.
So for me, what I utilize is a multimodal approach with a trauma-focused acceptance commitment therapy foundation.
Okay.
And because there's three, I would say, core areas of symptoms that we're really trying to treat with trauma, right? We're trying to treat the cognitive, right, the thinking portion, right? We're trying to treat the memory portion. In other words, in trauma, as an example, as you know, right, we have an issue with short-term to long-term memory consolidation. And so we get memories kind of stuck in the viscera in the body and the limbic system, right? And so we have memory consolidation issues that we need to address with a lot, especially complex trauma, right? If you're dealing with, for instance, human trafficking survivors, you're dealing with complex trauma, right? So you can't just take a cognitive approach to it, right? You've got to also understand memory consolidation, what happens, to memory in trauma. In other words, you have to understand some neuroscience.
Yep. Well, I would
Right.
also imagine too, depending on the age, a lot of it's pre-verbal because the children don't have the cognitive complexity in their thought and their, excuse me.
Yeah, exactly. You're right. You're perfectly on target, right? Which leads to the next portion, which is the somatic portion. And whether it's pre-verbal or whether it's complex or whether it's an even single incident that just happens to be trapped in the body, the reality is for most trauma survivors, we have to release that stored energy from the body as well. We might not see this with, say, single incident trauma, somebody gets in a car accident as much. For almost all complex trauma presentations, we're going to have body-borne symptoms that we have to be able to address. And again, CPT just doesn't do that. All right, EMDR doesn't do that. And so you have to have some other tools in your tool bag. So what I see is this kind of a trimodal approach where we are able to work between these three symptom presentations to address the individual holistically, both memory, cognitive, and body-borne symptoms.
What are some of the like more somatic approaches that you've studied and integrated into the work?
I love somatic approaches, and there's a lot you can do, and it's an art form. I think you would agree, right? Like somatic approaches and art therapy itself is an art form, but so I love, we talked about the Victor course and we talked about Krav Maga.
Mm.
I love using Krav Maga as a somatic portion, but as an example, to really move the body. And so that would be one example. And to start with, though, I mean, it could be as much, as small as just helping people reconnect with their body.
Okay.
Right. Dissociation, in many senses along the spectrum, of course, comes with trauma. And a lot of that would be dissociation from the body, right, as those triggers come up. And so it could be as simple as helping somebody reconnect with the body, physicalizing, trapped memory or energy with with Krav Maga, utilizing that, right? There are a couple of mechanisms of action that we could actually look at for why that's helpful, right? So, for instance, learning real world self defense, and I want to clarify, make sure real world self defense and other stuff we can actually apply, not just BS. Right, that new learning we know, and Vessel van der Kolk talked about it. Right, we know that new learning, right, can change the trauma memory. We can update that memory. And as we do that, we can remove some of that emotional charge. So we get some of that new learning. We get state dependent type learning, right? That state learning where we're maybe touching on the trauma memory while releasing that energy through movement, while also building a confidence. In other words, we have a pendulation process where we're touching the trauma and we're touching confidence. And by going back and forth, we can start to reprocess this over here. So it's not so much pressing on that schema that is, unconfident, helpless, right? But instead, now we're actually connecting it to a more confident sense of self. And so, as just an example right there, just for the emotional release, though, most simplistically,
Yeah.
right, as you are touching on those really difficult memories, right? Catharsis gets a bad rap, I think, in research, but there's something there. Anecdotally, what I've seen over 20 years that people are able to do with movement, right, and movement specifically that builds confidence and self-efficacy.
That's amazing. Because even this, been fortunate to be in the somatic space since the mid 90s, and I've never seen anyone integrate any martial arts, especially a combat oriented martial art like Krav Maga. I mean, I've seen things like more of the Tai Chi or Aikido type, more the slower movements type of things, not for trauma at all, you know, but still integrating this more in the somatic space, but never Krav Maga, never combat oriented art. Is anyone else besides you doing that? That's pretty amazing.
I don't know of anybody doing anything like that.
Yeah.
I think there have been attempts to integrate some traditional martial arts here and there, and there's some research out there, and a bunch of people have done it, for their dissertation, things like that. But nobody's really doing a program like what I'm doing that I'm aware of, especially one that utilizes a realistic martial art in its place. And I think that, from what I've seen, and again, anecdotally, is there's a pushback, right? That, and I've seen it since my entire time in this industry, right? Oh, it's too hard, it's too rough, or, martial arts will re-traumatize. Well, bullshit. I'm going to go ahead and just call bullshit. If you don't know what you're doing, you're going to re-traumatize them in a therapy office.
Yeah, right.
If you know, how to work in a trauma-informed way, oh, of course you can do this, right? If you can touch somebody's deepest pain, you can work with them doing this as well.
I would imagine just because you mentioned one of your skill sets is observe, like you're a powerful observer of human behavior. And I could imagine it must be really fascinating to watch someone come in and they perhaps their collapse, postures collapse and unconfident, no eye contact, the usual universal kind of you know, uh, not everyone does the same thing, but something along those lines. And as you help them gain the confidence and gain management over their physical body and their breath, that they can start doing eye contact, their shoulders drop, and much more confident. And the confidence is not just psychological, it's physiological. That must be
Mhm.
amazing to watch over time as, someone kind of opens up to their own, innate power, if you want to put it that way.
Oh, that is my favorite thing in the world.
Nice.
One of my favorite. In fact, one of my favorite exercises is just to go walk through people, the collapse state into the open, confident, powerful state, and just feeling that
Mm.
deliberately, right? It's such an amazing feeling, like you just mentioned. But that's why I do this work, to be honest. nobody does this work for the pay, right? We do it because we want to make a difference in the world. We want to help people live lives worth living. And so, yeah, to see somebody change like that is incredible. In fact, I just had an experience this past week just like that with a client that I've been seeing. One of the most complex presentations I've witnessed, which is fucking saying a lot because I've seen some pretty complex presentations working in anti-human trafficking.
Yeah. Yeah.
But working with this client for quite a while, and we did some intensive trauma sessions. And just kind of illustrate the point, and I'm not going to claim this is the only thing by any stretch of imagination. We've been working together a long time, but we're doing an intensive trauma treatment session. One of the things I do is intensive treatment where we'll spend 4-hour blocks together
Oh, okay.
doing trauma focused ACT, EMDR, and memory reconsolidation, as well as somatic work. And working with this client, been working for a while, and we've done some prep work and jumped into doing some intensives to try and get ahead of this. So she's been struggling to make real gains, right, over time. And what's nice is during the intensives is I'm able to focus a lot on each area and kind of um, customize it to the client, right? And that client centered perspective is very, very important, right? And so within that one block, we targeted some medical trauma. So significant. I mean, the triggers on this meant that this individual could not go to the emergency room.
Wow.
They were significant triggers. So about an hour out of this 4-hour block we spent doing what I call somatic EMDR or somatic flash technique. It wasn't really EMDR, we did flash techniques. We did a somatic based flash technique, and flash techniques is usually, sitting in an office using either, mental visualization or actual visualization as you take slices of a trauma, right, to process. And we did this on this particular event or series of events. It was a complex presentation using somatic based flash techniques for memory consolidation. And because the reason I chose this is because her triggers were so severe, right? That it couldn't just be a sitting in an office memory consolidation. We had to get the body involved, and so we spent an hour doing Krav Maga training, and during that we did trauma processing, right? And it went amazing. And we're able to reduce her distress down to almost nothing. I mean, hard to get down to nothing, but reduce the distress at that time down to nothing. And, time tells, right? And we see how it sits and how they're able to, take that out of the room and into their lives. So as you know, with this person several weeks later, they ended up in the ER. Could not avoid it. They had to go. They had to go. And had some things done, just basic stuff that all of us get done, but they could never.
The past yielded.
Zero problem at all. And in fact, the description was that what they told me was they sat there in the hospital room wondering what the hell is going on. I should be losing my mind right now, but this is just fine. I don't care at all. I don't care at all. Again, I don't want to say it was one, like, I don't know, we're still working on those mechanisms of action, but look, we can get the body involved. We can create confidence within that movement as we're resolving trauma, as we're reconsolidating memory, short term to long term, right? Man, I think we can do some amazing things.
So, like you just mentioned, you work with a particular individual female through a process. Do you mostly work with individuals? Do you run groups? Do you run workshops, retreats? Like, what's the process that you take people through?
Yeah. So I do a lot of individual work. So kind of, and I say the bulk of my day-to-day is individual work. Also running groups of the Victor course, which was originally developed as an all-women only course for trauma survivors, which now I run a men's and a women's one there.
Nice.
We started some retreats. We're just starting those up, some trauma healing retreats, including some for therapists, where the other thing that I'm doing is created some continuing education courses for professionals to learn how to do this type of work. And so I just started teaching this year continuing education courses as well. And so approved nationally for licensed professionals, so across the U.S. We'll be teaching those. And so teaching, for instance, just taught a nonverbals for clinicians course where taking my field experience and clinical experience to help clinicians be able to hear what their clients are saying when they're not saying anything.
Right. Yeah.
So we
So,
can spot those people like Rosa.
so where can people learn more about the Victory course, your individual work, these CEU units that are now available through your program?
Yeah, so our website is renovawc.com. So Renova Wellness and Consulting is our organization. My wife, Dr. Gleed, and I run that together.
Nice.
Yeah, so they can get information there. I do individual coaching, so I work with people across the country, doing one-on-one coaching. We do the groups, the retreats. I also do individual therapy um, for people looking for therapeutic services. And we just opened a clinic now, so we're expanding our ability to serve by adding some additional clinicians with the right training, right? And it's about having the right people with the right training.
Right on. You mentioned Utah. Where in Utah are you?
So we're in the Salt Lake area in South Jordan, Riverton area.
Excellent. Man, Joseph, this has been great. I love the work you've been doing. It's really nice to hear your kind of evolution over time, and you're heart driven and giving back to the world, seeing pretty much the world at its worst and helping it get to its best. So God bless you, man.
I appreciate it, brother. It was really good talking to you, catching up, man. It is always a pleasure, Michael.
Sam, Joseph.